For heart attack patients, time is critical. National guidelines call for a 90-minute door-to-balloon time. That's the amount of time it takes from heart attack patients' arrival at the hospital to the moment that blood flow is restored in the cardiac catheterization lab. Here at Santa Rosa Memorial Hospital, average door-to-balloon time is much lower, averaging 30 minutes less than the national guidelines. Dr. Patrick Coleman, director of the Catheterization Lab here at Santa Rosa Memorial's Heart and Vascular Institute, tells us more.
Well, we just heard a great story about a very successful treatment for Mrs. Kennedy. And what's really unique and interesting about her situation is this lady suffered from a life-threatening medical emergency. And we got her to the hospital with the right type of therapy at the right time so it could deliver the right kind of medications and interventions. About 5 years ago, cardiologists across the country recognized that it was important to treat patients with heart attacks very quickly. And the sooner that we got to the patients and administered various therapies and treatments, the better off the patients were. And that's been the focus of cardiologists across the country. What we did here in Sonoma County was, number one, we made sure there was a lot of public information about being aware of chest pain and the symptoms of heart attacks so that people knew what to do when they experience these symptoms, to contact the emergency medical systems and to get help right away. The second thing we realized, though, was that a lot of times there were delays built into the system that we had working. And we looked very carefully at ways to improve those systems to diminish the time between the patient's symptoms began and the time we were able to deliver therapy. A lot of hard work, in combination working with EMS, the emergency medical systems, and the hospitals to develop the ability for the paramedics to do the EKGs in the field with the patients who are having chest pain, transmit those EKGs or the results of those EKGs to the emergency rooms, have the emergency room physicians look at them, say, yes, this looks like a heart attack, let's mobilize the team, get them ready so that when this patient arrives, we're ready to go. This shaved off 30 to 60 minutes of standing around time waiting for the right people to arrive. So nowadays in Sonoma County, if you have chest pain, they'll likely do an EKG on you in the field and transmit that information to the emergency room. And if it does show a heart attack, those paramedics have to take you to a heart attack receiving center, one of which is Santa Rosa Memorial Hospital. The patient arrives in the emergency room with a diagnosis already made. The team is standing by. They start treating the patient immediately just as they roll through the door. Things are done, blood pressures are measured, blood is drawn, and then the patient's brought over here to the cath lab, and you can see behind me some of the monitors that we use. And at that point, we can very quickly take pictures of the patient's arteries, find where the problem is, find where the blockage is, and intervene with balloons, wires, little aspiration catheters, or like little vacuum cleaners that take care of the problem. What this does is that restores blood flow to the heart muscle as quickly as possible, and that's the major determinant about how well somebody does in a heart attack. We've been so successful here at Santa Rosa Memorial Hospital that in the first quarter of this year, we were the #1 hospital in the country in terms of our times from the door of the emergency room to opening that artery up. We're very proud of that because we know it translates into better and the best patient care.